I'm Dr. Christopher Nielsen, one of the spine surgeons at Toronto Western Hospital. Let me introduce you to a new patient experience and education initiative. Please take the next 5 minutes to learn about cervical radiculopathy. Let's start with a story, Dina's story, arm pain that keeps her up at night. Dina's right arm started to hurt about 3 months ago. For the first week, pain was mostly at night, but now her whole arm is painful all day long. The pain is worse in the thumb, but it also feels like it is vibrating or buzzing, and it feels numb. Dina has tried taking Tylenol and Advil, but nothing has seemed to work. Worst of all, she hasn't had a good sleep in a few months, and now is finding it hard to concentrate at work. I just want this pain to go away. It doesn't matter what I do, it is always there. Sometimes I can move my arm so that the shooting pain eases up, but I can't remember the last time I didn't have pain. I feel bad around my family because I have lost all my patients. If your symptoms are similar to Dina's, then you are suffering from cervical radiculopathy. What is cervical radiculopathy? Well, it's an irritated nerve root. It's a result of pressure on a nerve root. Similar to a jelly donut where the jelly squirts out, an intervertebral disc has a soft center. And if that soft center herniates or squirts out, it can put pressure on a nerve root, causing radiculopathy. What are the symptoms that you will feel? Well, the cardinal symptom will be arm pain, pain that shoots down your arm, oftentimes to the hand. But you can also experience numbness or weakness in the arm, as well as neck pain, and you can have any combination of these symptoms. Things that typically make your symptoms worse are inactivity and sleeping, whereas time and activity will often make your symptoms better. So what are your options? Well, the first option is to do nothing, but we typically only do this if your symptoms are largely resolved. We can do things that are not surgery, and that's often will be the first place that we start and the first things we talk about. Lastly, if symptoms are persistent, then we may talk about surgery to take the pressure off the nerve root. Things that are not surgery are largely exercise and activity, doing focused physical therapy for neck and upper back strengthening. We can try injections to place freezing and steroids around a nerve root to settle down the pain, or talk about medications that are not narcotics that can be taken by mouth. If surgery is the best option, the most common procedure is what's called an anterior cervical discectomy and fusion. It's done through the front of the neck, where a large portion of the disc is removed in order to see the disc herniation and pressure on the nerve. Once we see that, we can remove the pressure from the nerve and take the pain generating disc away. But since there's a large hole or space created by removing the disc, we now need to fill that space with a spacer and put a plate on front in order to fuse those two vertebrae together. So what's next? Well, we're going to consider your symptoms, and we're going to look at your imaging, your MRI, X-rays, or CT scan, and consider the impact on your quality of life. And all this put together, we will come up with a plan together. And that plan, maybe do nothing. It may be start with things that are not surgery, or if the symptoms have been persistent for a long time and have not gotten better through other interventions, we may even talk about surgery. Thank you for taking the time to listen to this educational video. You'll see here a list of resources that you can access following your clinic visit for more information on cervical radiculopathy.